Welcome to our presentation of personal health records, developed by the collaboration of Ophelia McMurray, Ying Lee, Karen Cross, Marion Kelly. This is for Nursing 353 of Jacksonville University School of Nursing, June 9th, 2013. We hope this is informative for you. Introduction. In 2009, the Affordable Care Bill was passed through Congress and is currently changing the workflow for medical profession. With the introduction of the Affordable Care Act, Section 1561 requires the development of standards and protocols to promote interoperability of systems. By July 2009, the first draft for meaningful use was published, with the final criteria being available by July 13, 2010. The goal of meaningful use is to promote the spread of electronic health records to improve health care in the United States. This slide shows the 3 stages of meaningful use. Each stage has a specific goal set that's to happen in an allotted period of time with an incentive of money at the end. So initially they want you to electronically be aware, that's from 2011 to 2013, and be able to communicate better and play around with it, kind of get comfortable with it. Stage 2, they're adding more. Now doctors can e-script, and it goes directly from the doctor's office to the pharmacy. So you can't say somebody stole my prescription book, and there's how many prescriptions out there that somebody can make out and try to hand out. The third stage is improving quality, safety, and efficiency, leading to improved health outcomes, because now everything is there in front of you. You can go from one doctor to the next, and they can all get on the same template and look to see what you've had done, the results of different tests. You might have had a workup done for the past month, and they won't be repeating tests that you already have had done because the results are right there. So it makes it better for the patient. It's more patient and user friendly, except that the programs haven't really been developed yet, so their goal of 2015 might lapse, and they have to have extensions in order for people to catch up with technology. How do personal health records help us achieve meaningful use criteria? As noted in the previous slide, personal health records, or PHRs, will assist the patient with giving the patient access to control their healthcare data. It will also give the patient a tool to utilize to access their healthcare information and better communicate with their providers across multiple disciplines and levels of care. This, in turn, should allow for improved patient outcomes through improved communication across the healthcare spectrum. These points are outlined in Phase 2 and 3 of meaningful use. Defining a PHR. There are many definitions of a PHR. The following definition is the most comprehensive. PHRs are electronic systems that allow people to record, access, and share health-related information in order to help them better manage their health care and health. To the consumer, PHRs are a way to truly communicate and interact with the providers to optimize their outcomes in health. In essence, PHRs are a portal to understanding health. List of common PHR components: lab and test results, medication management with refills, appointment request, after visit summary, clinician visit notes, clinical reminders, secure messaging, self-entered data, bill viewing, and payment. Attributes of an ideal personal health record. Each person controls their own PHR. PHRs contain information from one's entire lifetime. PHRs contain information from all healthcare providers. PHRs are accessible from any place at any time. PHRs are private and secure. PHRs are transparent. Individuals can see who entered each piece of data, where it was transferred from, and who has viewed it. PHRs permit easy exchange of information across healthcare systems. The rise in the need and use of PHRs. Prior to personal computers, personal health records were paper documentation of a patient's diagnosis and plan of care. It was truly up to the individual to maintain the records and care for their individual healthcare needs. Since the 1990s, electronic technology has become readily available through society. PHRs are part of the digital revolution for medical records and have the potential to utilize health information technology, also known as HIT, to facilitate information sharing among patients and caregivers. The combination of customer demand for information and healthcare demand for care efficiency prompted the need for PHRs. Continued, PHRs give patients the ability to manage their own health care, especially with chronic illnesses, and communicate directly with their primary care physicians. In essence, it empowers the patients to choose the correct path in their healthcare journey. Lastly, as a society, we have been challenged with decreasing the overall cost of healthcare. PHRs have the potential to assist patients in long-term care of chronic illnesses. This should result in fewer visits to the hospital and increased utilization of less expensive modalities in medical therapy. Influence of the Institute of Medicine, also known as IOM. The IOM has been instrumental with encouraging use of technology within medicine. The focus has followed these core principles that specifically engage patients in their own care. Care is based on continuous healing relationships. Care is customized according to the patient's needs and values. The patient is the source of control. Knowledge is shared and information flows freely. Transparency is necessary. Tethered, untethered, independent PHRs. The definition of a PHR is not enough to describe the different types of health records available to the consumer. Tethered PHRs are usually tied directly with the healthcare institution and linked to their electronic health record. Untethered PHRs are independent of a healthcare facility and therefore independent of a patient's electronic health record. A patient-controlled healthcare record is likely to be untethered PHR, which is controlled solely by the patient. Why are PHRs beneficial? Easy access of PHRs by providers. Provider can view, chart, and enter orders remotely from home or office. Provider can respond to patients via secure messaging or emails, decreasing the need for face-to-face encounters. Improve workflow and patient care delivery efficiency. Easy access by patients. Records can be entered, viewed, or modified by the primary care physician easily. Appointment reminders, clinical visit notes, and secure messaging are all convenient tools to help patients learn their illness, manage their medical appointments and bills, and assist in managing their chronic illness. What are the advantages of PHRs? Increased efficiency of delivery of care, improved provider satisfaction, improved quality of care, improved patient satisfaction. This reminds me of the Press-Ganey scores and how everybody wants to get a good score, and you want positive feedback from the patient and to make sure that you know that you've done the best you can. And it's not just that you go up a couple of points and get a pizza party. That's kind of like a fringe benefit. But for the most part, to know that you've done your job and it's been appreciated. What are the disadvantages of PHRs for patients? Patients who are not technologically savvy and also the elder population who truly need the care may not have the means to access or maintain the information within the PHR. There is a risk to the patient that the information may be compromised. Maintenance of the information can fall to the patient. If the patient does not accurately place the information within the PHR, the ability to accurately treat the patient can be compromised. What are the disadvantages of PHRs for medical professionals? Tethered PHRs are linked to a solitary healthcare system. Physicians outside the system will not have access to the patient's information and will revert to old practices of shared information. Inaccurate patient-entered information. The expense of having a PHR may be cost prohibitive for the smaller healthcare systems. The addition of updating and maintaining an additional tool for the patient will dramatically alter their workflow and may be considered too time-consuming to maintain. What are the disadvantages of PHRs and how would it affect current practices? There are still many changes that would occur to the end user's workflow. Whenever efficiency is created, it is due to many months of change and hours of additional work by the end user. Although there is much efficiency with PHRs, the automation of these processes decrease patient contact. Some points of personalization of healthcare are removed and may add to a sense of the patient feeling more disconnected from their healthcare provider. Initially, when we started using computers at the bedside, patients felt we were spending more time with the input to the computer than with them. Over time, as patients came back for different reasons, they realized that this was an effort helping them and being more accurate about their previous history, and that we were more futuristic and forthgoing and not stagnant, staying behind under paper. Legal aspects of PHRs. The Privacy Rule of Health Insurance Portability and Accountability Act, also known as HIPAA, regulates the use and the disclosure of personal health information held by covered entities, which include hospitals, primary care physicians, and other medical entities. Personal information is protected by HIPAA to prevent unauthorized disclosure. Are PHRs a part of the HIPAA regulations? HIPAA applies only to covered entities, so tethered PHRs are covered under HIPAA, but many independent PHRs are not covered by the regulation. Who are the major providers of PHRs? The largest healthcare industries are currently providing access to a PHR. These are the tethered PHRs. The healthcare institution is responsible for the maintenance and the security of the site. These include the Veterans Administration and Kaiser. Each large hospital system is incorporating a PHR into their practice due to the meaningful use criteria. Who are the providers under the untethered PHRs? Untethered PHRs are typically owned by independent organizations looking toward the needs of the clinical practices. The clinician is responsible for the initial installation costs, maintenance, and upkeep of the information. The information is accessible on the internet through a secure service, but is still not held to the strict HIPAA standards. These types of PHRs can be cost prohibitive to the independent practitioner. One of the attendings I had a conversation with, I was told that they were offered an electronic package for $50,000 to $80,000, but it was a primary program. There was additional cost for each template that they wanted to add after that. And the doctor alone with the first 50 to 80,000 was thinking, how many patients would he have to see in order to cover the cost? Web-based or patient-controlled PHRs. Because technology is advancing at such a rapid rate, many small companies have surfaced and have produced a variety of web-based applications to assist with facilitation of medical information. This is the most unreliable source of information because the only individual who can enter the data would be the owner, also known as the patient of the application. They may not have the knowledge to enter the data appropriately or note when medical intervention is necessary. Conclusion. In summary, PHRs allow medical institutions to fulfill requirements of meaningful use and gain financial incentives for their participation. The patient is the one who should benefit the most. Through proper communication, their healthcare has the potential to become more streamlined and the focus remains securely on the patient outcomes. In summary, the following quote from Charles Safran. When patients participate more actively in the process of medical care, we can create a new healthcare system with high quality services, better outcomes, lower costs, fewer medical mistakes, and happier, healthier patients. Thank you.